Today we will talk about Crohn's disease, an inflammatory bowel disease. This disease affects all parts of the gastrointestinal tract and is a chronic inflammatory disease, mainly of the small intestine. Although the causes of Crohn's disease are still unknown, it is likely caused by a complex interaction of genes inherited by the patient, as well as the body's immune system reacting to a virus or bacteria from the environment. But let's go see the history of the disease. Hippocrates was the first to describe inflammation in the gut, and his motto was, "All disease begins from the gut." It is certainly something that was mentioned in both traditional Chinese medicine and Ayurvedic medicine of India. The next scientific record would be by Samuel Wilkes in 1859 in London, which concerned a 42-year-old woman who died after several months of diarrhea and fever. It was first described in 1913 by a Scottish surgeon, Thomas Kennedy Deal, but was named in honor of New York physician Beryl Crohn, who in 1932 co-authored with his colleagues Dr. Ginsberg and Dr. Oppenheimer 14 cases characterizing Crohn's disease as regional ileitis. It's worth mentioning that Crohn's name was published first in the post because the names were entered in alphabetical order rather than how much each of them contributed to the study. Let's get to know this particular disease. Its main features are the reduction of the diameter of the intestinal lumen and the fact that healthy parts of the intestine alternate with inflammatory lesions. They are intermittently affected by thickening, edema, fibrosis, and adhesion of the affected intestinal tract and other adjacent organs such as the skin, bladder, uterus, and vagina. The main complications of the disease are intestinal obstruction, malabsorption of food, perforation of the intestine and bleeding from ulcers, the formation of perianal fistulas with increased incidence of cancer. Other complications include various dietary complications, arthritis, skin problems, inflammation of the eyes or mouth, kidney stones, gallstones, or other liver and bile vessel diseases. The most common symptoms are abdominal pain, frequent diarrhea, rectal bleeding, fever, and weight loss. The diagnosis of the disease is determined through various ways, such as colonoscopy if the problem is in the large intestine or in the final stage of ileum, with the help of biopsies to confirm the diagnosis, MRIs if the problem is in the small intestine, and blood and stool examinations. There is currently no cure for Crohn's disease. Various treatments are applied with a variety of drugs which can significantly reduce the signs and symptoms of the disease. Specific foods which causes discomfort should be avoided, and conservative treatment of the disease should always be guided by specialized gastroenterologists. Surgery is the final treatment solution in Crohn's disease. Of course, it is necessary in case of complications from the disease, mainly obstruction or perforation. Also, laparoscopic treatment surgery is now possible in Crohn's disease. Surgery as a treatment can and should be avoided, especially in the early stages of the disease, as available medications usually put the condition in remission for a long time. The incidence of Crohn's disease is higher in industrialized countries, urban areas, and the upper socioeconomic classes, and affects approximately 50 people per 100,000 of the overall population. It is the most common disease for Europeans and mostly common in Northern Europe and the USA compared to Central and Southern Europe and the Middle East, with the exception of Israel. If you want to be part of a wider scope to inform and interact with professionals worldwide regarding matters relating to the challenges of dementia and other related diseases and handling suggestions, just subscribe, click like, and hit the bell to become part of the memory team and community, a wider community with an excellent purpose.